Hello everyone. Today is May 24th and I am doing a check-in on how I'm feeling after losing my mom to COVID-19. It's been a little while now since my mom has passed. She passed away on May 5th at 1:39 p.m. And to be honest, right now I have been getting increasingly angry because there seems to be a lack of accountability for how nursing homes are treating the residents at their facilities. So to go on and explain a little further, I reached out to the mayor of Fitchburg, which is located, the nursing home where my mom was at was located in this particular facility. And the communication seemed really promising at first, and he seemed to be an advocate on my behalf. He also identified that he would be reaching out and calling me to do a check-in because he had a meeting with the Department of Public Health and their nursing home facility. So after the emails that I received, I didn't get a call. And I actively reached out again and I was told, oh, I provided your telephone number to the nursing home so that they could call and hear your concerns. Granted, I had called the nursing home multiple times, several different times. They have my number. It's a little late to hear about my concerns. My mom's dead. Like, what do you want to know? Like, how you could be treating your residents better? You should already be doing that. And I understand that this illness is crushing people's lives, and facilities haven't had the opportunity to develop a proactive action plan. But I cannot understand how there wasn't some type of quarantine practice and procedure in place already for things such as the flu or for other types of ailments, because there are other routine contagious illnesses that can stricken a nursing home, and there should already be quarantine measures in place. I understand that this is a little bit of a higher extreme type of illness, but I do not sympathize with how the nursing home handled the treatment of my mother. They did a bad job. They did not proactively address symptoms. And I had been calling, along with my family, had been calling the facility, questioning when does the nursing home send patients out to the hospital to get more aggressive treatment, especially if someone has a history of things such as asthma, diabetes, high blood pressure, any of those high-risk elements. And I was just getting the runaround. So yes, there are really good nursing homes out there, but unfortunately I disagree and do not believe my mother was in one. And I feel that the placement and how they treated her contributed to her passing. The ICU staff at the hospital, Leominster Hospital, treated my mother with respect and dignity. They went above and beyond, FaceTiming, calling me with updates. I didn't have to every 10 seconds give them a call. They were actually proactively calling me the way that it should have been. That level of communication was just astoundingly better. So I felt that at least when my mother passed away, she was at a location where she was cared about. Now, the nursing homes a lot of them are for-profit companies. They need residents. That's how they make money. And sometimes I feel like these places will ultimately ignore some of the higher level symptoms they cannot control so that they can make some cash. Okay? Because if they don't have residents, they don't make money and they don't make a profit. That's how it works. But it's not acceptable because my mother shouldn't be a statistic. I get updates I see the news. Oh, above 70, high risk, we should open the economy, this and that. Only a certain few people should worry. If they're afraid to die, stay home. This isn't about that. I'm not concerned about that discussion. I'm concerned about the treatment of a broken system, because the nursing home system itself has been broken for a long period of time. And I will continue to advocate for the good quality care of the elderly, because they many times do not have a voice. They are often, the abuse of the elderly is a statistic that is arguably underreported. Some of these individuals have ailments such as Alzheimer's, dementia, and they can't advocate being abused and say, hey, I'm hurting, they're hurting me, someone's not giving me my medicine, they're not being fed, hydrated. When my mother reached the hospital, she was severely dehydrated. Clearly, she was in a condition where she was not properly cared for. And my mother is a Japanese woman who primarily speaks, she can speak broken English, or she could speak broken English and Japanese. Do you really believe this nursing home went above and beyond to try to go and understand her condition and try to get help for her? No. They failed. So that needs to be put out there.